Hi, everyone, and welcome to the Relationship Renovation Podcast. I'm Tarah Kerwin.
And my name is EJ Kerwin.
And as always, just thank you for being here. Thank you for listening. Thank you for all of your amazing feedback on our social media and those 5-star reviews. And we're going to kind of just jump right in today because we have really exciting guest speakers today.
Yeah, absolutely. I mean, we're always blessed to have really interesting, smart, cool people come into the show and also explore really a lot of topics that are very much related to relationships and some topics that are just like, hey, here's something that's really interesting, really important for you to check out and see if it's something that might, be useful for you in your path of wellness. And so today we have two guests. I'm going to sort of introduce them both at the same time. And then if you guys would tell a little bit about yourself. Our first is Tim Mills. Tim is the owner of a broad-based mental health facility here in Tucson called Cathexis. He's also the owner of a new facility that he's opened called Cathexis Psychedelics, which is sort of where our topic is today. We're going to go into. And as always, we also want to say that he is, his other stuff. He's a therapist. He's a husband. He's a father. He also is a amateur handyman. And we also had a discussion that he's a Whataburger enthusiast before the show began.
He knows the whole history.
Hi, Tim.
With an introduction like that, what can I say?
And then along with him is Tracy Grabb. She's a licensed professional counselor. She's at Cathexis as well. And she is a psychedelic integration specialist. She's a mother and amateur interior decorator, we just found out as well. Welcome, Tracy and Tim.
Thank you.
I think we should say that 3 times. Psychedelic. What is it? Psychedelic integration specialist. Like, okay.
And she's the intelligent, interesting one that you mentioned being here today.
She is.
Thank you.
You don't fulfill that criteria. It's always nice just to hear about you, a little bit about your background, how you got into the mental health field. Do you mind starting, Tim?
Oh, yeah, absolutely. So self-diagnosed ADHD, I think anybody who knows me would agree. One of those didn't know what I want to be when I grow up. Started out working from high school. My first job actually in high school was driving around buying beer for 7-Eleven, trying to bust the people on the counter for selling a minor beer, and they'd get fired on the spot.
You were like a professional narc.
Right? Yeah. So moved on, ended up finishing high school, went into Marine Corps, did that for a while, got out, went back to school, got my bachelor's in business, got a job at a bank, was a bank manager for several years. My wife Susie and I had our first child, decided to move out here to Tucson to be here with her family. And at that point, just started wandering around in jobs, worked for Microsoft, worked for a security guard company for a while, and then decided, really, what is it I want to do with my life? And that's when I got back into going to counseling. Had a couple classes with you, EJ.
Yeah.
So I remember that overlapping. And then went to work for some agencies in town. We overlapped at a place where we worked before for a little bit.
Yep.
And that's just kind of led me here.
Yeah, you had a long and winding road into the mental health field as well.
Yeah, a lot of other life experience I get to draw into
I think
my
that's
career.
Fantastic. Not just because that was me too, but I think it's nice to have that background coming in.
Very nice.
Thank you, Tim. Tracy, you mind sharing?
Absolutely. It was at some point after I had my first child that I recognized I really wanted to work with women and children in some capacity. Initially, I started out thinking, well, if I want to work with children, maybe being a teacher would be something I'd like to do. So I did start my education in that way, and then very quickly realized how many people would come and talk to me about issues and would want direction or understanding or assistance in some way. And I can't remember who suggested being a counselor, and it really resonated with me. And so I moved in recareering into that from being a cruise travel specialist.
Wow.
And have enjoyed it ever since. It's the perfect fit for me. And then coming out and then doing our internship, our practicum internship, I began working with a lot of mandated adults. So basically parents whose children had been removed by DCS or those that were in probation and had probationary requirements to attend therapy. And then from there, moved over to another agency that was truly children and family oriented, and really grew from there. And that's where I met Tim. And then have kind of moved up in the world. And then I had an event happen with my oldest, a medical event that was really tragic for her. But it allowed me the opportunity to realize and reflect, I really want to get back to working with people and not overseeing people. And so I made a transition. Thanks to Tim and Susie, I was able to come on board to Cathexis, and it's been blooming ever since.
Right on. Well, thank you both. I mean, this is such an interesting topic, and so I think we want to dive right in. And I think maybe a good entryway, though, is, you had a counseling facility, Cathexis, which is, sort of traditional counseling,
right?
Broad base, offering services to a lot of people. But then you've sort of had this new business adventure and also just this new approach to helping people. How did that originate? Why did that originate?
Yeah, it started for me probably about 5 or 6 years ago, and it was just browsing Reddit a lot and just seeing article after article of research coming out on the effects of ketamine assisted therapy and MDMA assisted therapy. And that's going through trials with MAPS, the Multidisciplinary Association for Psychedelic Studies. I think they're in their second phase 3 trial right now. And just seeing the positive results and personal experience when I was 8 years old, was in Little League, and I went behind the concessions dugout and picked up a used cigarette butt and, put it in my mouth and tried it to be cool and never again.
Didn't like it.
Yeah. And that's probably the extent of chemical
altered state.
Of altered state for me. That was enough. But just reading how effective this appeared to be. And so I just kind of kept an eye on it. And then I started seeing personal testimonials. And then, fast forward another couple of years, I start running into some people and expressing, no, this is legit. I was like, there's got to be something into this. We've got to look into it. And it's just kind of, Susie and I traveled to Colorado, to California to see a couple other providers. We got some training, and just the more we dug into it, the more it's and I don't want to say it's a panacea, but there's something to this.
Just for clarification purposes, what is the research showing around what it's helping?
In particular, it depends on the drugs right now. And then it also depends on, how they set up the research. They have to research a specific, malady, if you will. So they're learning more and more. There's so many studies that are coming out now. In particular with ketamine, they noticed, and this is how ketamine started, it actually was a anesthetic developed in 1962 or something, and got FDA approval for use in humans in 1970. And at that point, they started noticing people who would be in crisis or something, and suicidality was a piece of it. After the ketamine, they wouldn't have suicidality for an extended period of time. Right. So that's one of the real particular things about ketamine, is it seems to really help with the suicidality.
Wow.
Right now, it's been studied with treatment-resistant depression. One of the things about ketamine is that it works a little bit differently than the typical pharmacology. The typical pharma works on SSRIs, selective serotonin reuptake inhibitors. And I think the newer generations even add norepinephrine. Ketamine works on the GABA and the glutamate neurotransmitters.
Okay.
And they're kind of like they're kind of like the doormen.
Yeah.
So what GABA does is between the synapses, the neurotransmitters have to go between them to carry the message or the electrical current. The GABA one, let me make sure I get this right because I'm not a neuroscientist. The GABA one is kind of like the door guard. He's the big guy that blocks the door. So he plugs up the uptake. So basically, if you've got an alert signal going through the neurons, he can block it and stop it.
Okay.
So he inhibits or stops the signal. And the glutamate is the other. He's the nice guy that's always holding the door open for everybody.
Right.
And so he allows all the neurons to flood in. And so the way it operates on those has some really interesting effects that is different than the way you're targeting the actual serotonin and norepinephrine.
So I know I'm definitely not my strength. Probably Tara is more so about like how drugs interact with the brain and in the context of mental health. But I know like a lot of things like we don't even know why they work or why they
Right.
do the things that they do. You know, is that similar with psychedelics, or is it a little more like they have an idea of the experience it's creating, or the neurochemical experience it's creating that is helpful in someone who is suffering from depression or anxiety or suicidality?
That's a great question. And I think some of it, they're learning more as they go.
Mm-hmm.
And then there's always the question, do we know? Are we still in the Middle Ages with neuropharmacology, where we're at the equivalent of putting slugs on for a good bloodletting? So there's always going to be that question. I'm looking at the results and I'm looking at people's testimonies.
Yeah.
And then lately I'm looking at what I see and what I witness. And
Right.
whatever it is, I kind of think of it as like a computer. So long we've been looking at like the amygdala and the hippocampus and all these structures, kind of like you look at the parts of a computer. But we don't look at the software, which is the ones and zeros, the information going along them. And I think that's an important piece of it. It kind of gets overlooked, and maybe we'll get there someday.
Well, you've come along for the ride, Tracy. Like you've jumped in on this as well. I mean, what was appealing to you? Like, why did you decide? Like, yeah, I'd like to sort of be a part of this as well.
I really have my own journey with psychedelics as of recent, especially after my oldest medical issues and walking down a different road with her because the SSRIs for treatment-resistant depression were not working. So I have to really give it to my oldest because she took me on this path, which was amazing. And in this path, my own experiences were profound. And I was able to work through even some of the underdeveloped areas of my life, but that were also part of maybe that I wasn't performing to my best ability every day. And so within that kind of frame of reference, I realized at some point I did want to get into psychedelics, whether it be ketamine or psilocybin once that is approved. And I had made mention of it to Tim maybe a year before, and I hadn't realized they were working behind the scenes at that time. And so when they came to me and asked if I wanted to be a part of this, I immediately said yes. It was an automatic response. And for me, having been through the ketamine as an experiential and training, it was profound. I had a profound situation happen where my mom had passed a few weeks before the training, and the relationship was really rocky. So I was left with a lot of grief and loss and unanswered questions, and almost really putting a lot of pressure on myself. Why didn't I do things differently this way? How about that way? With ketamine, once I was in that experiential, my mom was a big part of it. And the relief that I got from her passing was profound. Profound in a way that I immediately left the first ketamine session and felt more of a sense of wonder and peace, and that life is wonderful. It can be wonderful. So the ketamine really allowed me to silence kind of the gatekeeper there that frets and worries about everything and just brings to light what really I needed to look at.
Yeah, that's right. I totally forgot about that, but that's right. Yeah.
Yeah.
That was huge for you.
It was astounding.
Right.
I mean, profound is the best way that I can describe it. And then as my family experienced me after having 2 experiential treatments, they noticed the calm, they noticed the brightness in my face. I was smiling a lot more, and life didn't feel heavy. It felt so heavy going into that. And so both of those experiences, one being really dark and then the second experience being very light, it actually was really reflective of where I was going and lifting all that pain and suffering off. Now, traditional therapy, which I do, can take a really long time because, again, that gatekeeper is holding us back from really getting deeper. And within ketamine, it lifted up what needed to be lifted up. And I could process it a little bit with even, my own therapist, and, having friends as therapists was very helpful. And so I was even integrating afterwards. And I noticed that the more I talked about it, the more I integrated what I was feeling. The years, full disclosure, of trauma and abuse that I've went through, it felt like all of those gates had fallen down. And I got to experience life in the moment. The worrying and the fretting went away. And again, just profound. And I was sold. After that training, it was really made clear to me, as like Tim was saying, that this is what we want to be doing. Treatment-resistant depression, post-traumatic stress disorder, addiction work even. And, even as of recently, really seeing what the effect could be within a couple of doing this kind of work together, and how a relationship can change for the better because of what comes up and the bonding of the experience. That has changed me dramatically, even more so that I can see this is what we want to do for people. Give them the relief that maybe they've been in therapy for years and haven't been able to get, or treatment-resistant depression. I think about my daughter having many, many different meds thrown at her. And that the shift is profound in a shorter period of time. And then the work afterwards
is important.
Is amazing. It's so different, right?
It is a powerful pharmacological. I wouldn't imagine doing it without the therapy. And of course, I'm biased as a therapist.
Right.
But I think the integration, just the experience you have in that, and then going back and reviewing, what it is that basically you're opening up the unconscious to talk to you. It's similar to dream work or Sandtray, which I absolutely adore Sandtray work. But it's that same kind of thing. You're opening avenues to your unconscious. And then when you're able to kind of look at that and look at the symbolism and look at the meanings you place into those symbols and how they're organized and what message is behind that.
Right.
That's the ongoing healing. The ketamine is the door, and this is the work that can really you can do that maybe in traditional therapy is a lot more guarded.
So can I ask a question really quick?
Yeah, go for it.
Because I always know how powerful it is when you're able to have that experience, stand by it because you know how impactful and profound it was. What have you noticed across, because I'm sure you have a very diverse group of people coming in to get ketamine treatment. What would you say? I mean, is it all different? Does it look the same? How would you, for our listeners, how would you kind of describe what you've seen outside of when you've done it yourself?
Yeah, and you're tapping into an important point. Is it can be a very unique and tailored experience. I've had people like myself, and I had some school bullying, trauma, disclosure, stuff like that, but I had a relatively stable childhood. And so for me, because we had to, in our being ketamine trained to be a ketamine therapist, there's an experiential piece of it. And so when I went through my experiential piece, it was just kind of giggling. And I'm not going to say it wasn't a deep trauma kind of thing, or it wasn't a depression or an anxiety thing, but it did kind of expand my appreciation for life. I remember when I was in the state of it, being at this point where it was like, I could die right now and I'm completely okay with it.
Wow.
And I can't imagine, in our normal default state of not having that survival anxiety and how much that affects what you do. And it's there for a reason. I mean, obviously we're geared to stay alive, but to have that experience and how profound that was to be able to then look at the world from this, almost Buddhist, absolute detached state was really cool. Yeah. And some of that I take with me today. So it's helped. And again, through the integration that.
And so Tim's talking also about that non-ordinary state of consciousness that ketamine affords us. And in that space, what comes up when the worrying and the fretting goes away and we don't have control of what's coming up, whatever appears is meant to appear at that time. And that's basically the garden that you get to start to work in, so to speak.
Well, that was interesting. just tying together two things you talked about from different sides was, Tim, you first started talking about it was glutamate and another neurochemical that like kind of are the gatekeepers and the letting in, keeping out. And then you talked about this experience where all of those barriers are sort of like experientially, you experience that like of being blasted away. And it sounds like that's at its essence what you've experienced, and what you're facilitating people to experience is just this like sort of removal of a lot of the infrastructure that we create to sort of like, keep us all packaged in together. So whatever it is, though, that when you remove all those obstacles, it's going to be highly tailored to who that individual is. And I think it's like, that must be really interesting as clinicians of like, you don't know what's behind, curtain number 2, right?
That's right.
Yeah.
That's a great way to explain it, EJ. It really is. And, back to Tarah, to your original question, we are tailoring the integration piece. It is person specific. Not every person that will come in comes in with the same intention. What comes up for us isn't going to be the same. We might go into it thinking, I'd like to work on being more open. That may not necessarily be what ketamine brings up for you.
It might know of something more important that you need to address.
That's right. And the importance of intention is there. You still want to go in. And I like to tell people, or suggest to people maybe going in and saying, I'd like to be open to what comes up.
Right.
But having an intention is wonderful. You need that. And then afterwards, we take what comes up and your intention and see how we can connect those if they are connectable, or what came up is much more important. Now let's set up a treatment plan to begin to work on that. And then the work is also accelerated. I want to make that really clear for people. This isn't 5, 6, 7 years of therapy. Now you're targeting some areas, and because of the ketamine, it stays with us. And so we can still kind of process through. We have a new outlook. Like when Tim said, things just look different, life seemed different. Yeah. I remember after mine, the trees look different, the leaves, the plants, the birds, everything it just looked brighter. And so with that mindset, right, then we can go in and start to delve into areas and work on them, and even discuss maybe at some point a few more ketamine sessions would really bring that person even further up from what they've been stuck in, and they get to live a fuller life.
Well, and I remember so you guys had come to our staff meeting to kind of introduce yourself and talk about your Ketamine Wellness Center, your Cathexis Psychedelics. And I remember thinking, wow, this is so interesting. And you guys could have probably been at our office for 6 hours, and all the questions that all of our clinicians had to ask would not have been answered. But I remember thinking because we're our frontal lobe, we are just on all the time. We can avoid, we can deflect, we can busy ourselves. And it's like, and I might be getting this wrong, but how I perceived it is like, imagine being able to have your frontal lobe shut off and see what is under there. Because I'm really good, and I have a lot of clients who are really good at being in their executive functioning brain. Hence, avoiding a lot of stuff that we really don't want to feel because we don't like to be uncomfortable.
That's right. No, absolutely. And I think too, with ketamine, when it brings up what it brings up in therapy, traditional therapy, I always leave the session wondering what I didn't hear. What that frontal lobe blocked them from bringing up, because they may not believe that they're capable of managing it, dealing with it, talking about it. That goes away with ketamine. It's amazing.
So let's just contextualize this a little bit for a listener, because there's a lot. There are some people who have some idea about psychedelics and ketamine, and some people have no idea. So you opened Cathexis Psychedelics. But I assume because of state laws right now, the only legal psychedelic really is ketamine, right?
Yeah, we have no interest in losing our license to operate at this point.
That's right.
It is legal.
Yeah, the ketamine is legal. I have completed the training with MAPS for MDMA assisted therapy. So if things go the way they are going and the results continue showing what they're showing, FDA is slated to hopefully approve that as a clinical drug in like 2025, I think.
Okay.
And at that point, it'll be the people who are running MAPS, Rick Doblin and company. They have a for-profit wing that they've set up that's going to actually be kind of in charge of administering and overseeing who can do the MDMA assisted therapy to make sure that there's the proper controls, that it's done out into to the public the way it was tested. And so I've gone through that program.
So currently, in Arizona and probably in a lot of states, if somebody is interested in that psychedelic experience being integrated into their therapeutic work, they're probably going to go and have a ketamine treatment, correct?
Right.
So an individual calls you guys up. They say like, "Hey, I'm interested in this. What is the process like? How do they enter the stream, and what can they expect?"
That really is. I'm going to give a shout out to Tim's wife, Susie Mills.
Susie, she's
and
here.
Susie Mills has been building the program with our psychiatric nurse practitioner. We have great staff around us and have, there are protocols out there. And so we follow those protocols. So we definitely first want to screen people to make sure that they are qualified to have ketamine. If you have untreated high blood pressure, things of that nature. If there are some psychotic mood disorders, that could, really be a rule out. So before somebody even gets into the office, we're making sure that they have the understanding through our website about what this would look like and do you qualify. And then they'd fill out the paperwork. And then we move forward with assigning it to a psychedelic integration specialist. And then somebody like myself would get in contact with the client and would work with them. And if the psychiatric nurse practitioner has reviewed the additional paperwork they've turned in and has approved them, then we're setting up the first session.
Okay.
So medical screening approval
Mental
is
health
very
priority.
important.
That's
And mental
that's
health,
the first step.
Okay.
Once we get initial paperwork and even really getting a full intake packet.
It's a pretty safe drug.
Yeah.
It is DEA Schedule 3, so there is some potential for addiction. That does concern me with some of the infusion clinics and other places that come around. You can even order ketamine troches, oral tablets, basically online. And so I don't know what the oversight is on stuff like that. And I think that's going to be inevitable. There's going to be profiteers off of this. And that's something the field has to manage responsibly. But overall, it's a safe drug. Hypertension is the one thing that they monitor for. And then on the psychological piece, we want to make sure essentially that we get a sense that they have the ego state. So if there's family history or personal history of psychosis, to where we think going into an altered state might trigger something where the reality testing is really going to be challenged and they might, kind of have an uptick of that, then we're going to pre-screen that out. We're going to see about doing some preparation work first before we even consider that. So we try to, make safety paramount.
I love about this is we all know as therapists that one of the foundation of our work is creating a safe place, right? We can't get people to move forward if they don't feel safe in the environment. And I love from the medical side is that and the psychological side that you're setting people up that when they walk into this experience, which might be startling, probably is going to be startling, that there's a foundation that they are safe. And that's always been the missing link in psychedelics use is you're doing it in somebody's backyard or up in the mountains or at a party. And it's just
and who's facilitating?
Yeah.
I'm not sure.
Yeah.
You're doing it by yourself.
Yeah. And that's also what's kept them in the dark and kept them misunderstood. And you guys are creating this amazing environment where this is legit, this is safe. You are in a holding space where you can let go.
It's a core tenet of psychedelic therapy. It has a term they call it set and setting, which set is short for mindset, and it's all about creating that safe place, managing the anxiety of going into an altered state because that's a scary proposition.
For sure.
That's right.
So we definitely want to make a safe place. And I think that can help facilitate the ketamine opening the doors and for something to come out that might want to come out. we've got the metaphorical womb, if you will, to hold that and keep you safe.
So once someone is medically approved, mental health looks, ego state feels good, then what happens?
Sit them down in the chair and have fun.
Is there anyone in the room with them? Like, how do you guys facilitate
So when somebody is when they're medically cleared and they're assigned to the integration specialist, we are actually, there with them. We can be there through the intake process. We're working with them on their intentions. And this is very personal. It's very person specific. And our role is to be there to support. And if anything does come up, we are right there with you. You are not alone in the ketamine session, the ketamine treatment. So the routes of administration, the troches, as Tim mentioned, the sublingual, those are what that is, the intramuscular injection, and then, as Tim mentioned too, the infusion. So with the ketamine, the intramuscular, in the way that we do it, you're not going into the room alone. You're not sitting there for that entire period of time, which it really isn't that long, by the way. I mean, we're talking about from the time of injection until you're starting to come out of this, maybe 45 minutes to an hour.
Yeah, I think that's huge because so many people are like, I don't want to feel out of control for 8 or 9 hours. And I try to help them conceptualize, like, actually, ketamine treatment is about 40 minutes to an hour. And EJ and I experienced it. We went through a training, and we'll talk more about that. But I think that's so important because some people have this assumption that it lasts like 9 to 10 hours.
No. Now,
that's probably relieving for a lot of people.
The openness can last a lot longer.
Absolutely.
And the effects of what the ketamine bring up and just almost giving you a new set of eyes, so to speak. So you walk out feeling different.
Yeah.
But when you're in the ketamine treatment, somebody like myself would be sitting right there with you. And I know what your intention is.
Yep.
I'm watching you. I'm monitoring you as well. Some people might need a little extra support. And so we talk about, appropriate touch. Do you need me to hold your hand? What would that sign be? So these are all things talked about prior to that first injection. And then while they're under, I'm right there with them. And I love to scribe and take notes because I like people to, have something that they leave with. Like, you grimaced at 11:10,
right?
Or your hands moved and fluttered, at 11:20, or whatever that looks like. And then afterwards, something that they get to leave with. But the afterwards piece is really crucial.
Because they can read that, and then it's going to trigger something that happened in that experience. That ketamine work, as I referred earlier, it's like dream work. And like dreams, it kind of fades over time. You lose contact with that altered state, what it was like to be there. So if you've got that transcription there, sometimes that can take you back. The playlist, music is essential in this work. It's kind of like if the ketamine is the boat that's taking you on your journey, the music is the wind that blows the sail. And it doesn't have a necessary direction. The boat's going to go where it's going to go, but the wind is what propels you. And so that music can really bring back stuff too.
Yeah.
This is one question I've been asked too. Like some of people that I try to describe it to, they're like, oh, are you like awake? Are you like up? Are you sitting down? Are you, again?
Yes.
Right.
Yeah.
All the above.
Yes. So we make sure that we have, really comfortable furniture for people to be able to lay down. This is a lay down experience with the intramuscular and even infusion. And I know in my experience, I could barely move my hands.
Right.
I don't recall even thinking about my body anymore once I realized, I can't move my hands. That all went away. And then coming out of it, it's important that I did have somebody who was right there asking me, what was this like for you? What came up for you? And then we can take that further. So they're in the room. It's very comfortable. Now we're talking about the setting, right?
Yeah,
the mindset
right.
and then the setting. So as Tim mentioned, so we ask people, what kind of music would you like in the background? We give them the eye shades. So they're laying down and they can really get into their full experience on their own. And then even the scent piece, right? So is it Palo Santo? Maybe somebody might say, I like, the smell of lavender. Could you maybe have some essential oils right near me? And all of these sensory factors that come together in the integration piece during treatment are crucial.
Yeah.
So as opposed to going into an infusion center and, you're put into a comfortable space, hopefully, but that person that can hold your hand if something were to come up is really important, and it's missing there. And then when they're done, yes, they're making sure you're medically cleared to be able to leave. But then where do you go for the work? I have all this in my head. This amazing stuff has come up. What do I do with all of this?
So my ADHD is going to kick in here. I've had something I wanted to say 3 times, and you just opened the segue again. So before I forget a 4th time,
run.
Right?
Go, Tim. Go, Tim.
The importance of the integration. One of the things that we're doing different, and I'm going to take this moment to give a shout out to Kate Kincaid at Tucson Counseling Associates. She did the training with us when I did my training for Ketamine Assisted Therapy, and she does some integration work here in town. So she's absolutely a recommended provider. But when I did the training with her, when I was having my experience, I remember at one point kind of coming to a little bit and lifting the eye shades, because ketamine's a very internal experience. And I think part of it is the anesthesia piece of it. It numbs the nerve endings in your body or whatever. So you start to lose that feedback that your body is constantly pinging for fight, flight, freeze threats. Well, then what's your mind going to do with all that extra energy and all that extra free time? It wanders. And so I think ketamine, different than other psychedelics, it's an internal experience. Whereas MDMA and psilocybin stuff is much more external.
Very driven by stimulus coming at you.
Exactly. But one of the things I noticed when I looked up, and the room's dim because your eyes are really sensitive, and I could see Kate, and I could see the facilitator, and I could see another trainer that were practicing the therapist role. And they were just sitting there, kind of silent. And all I could see was their silhouette. And it was so cool. And for me, it was reminiscent. I kind of had this overlapped image. I don't even know how to describe it. It's like both were real, of like the Chinese terracotta warrior statues. And there was something that was just so grounding and powerful, like and kind of the essence of Earth.
Something.
Yeah. And it was so safe. And for me, I realized at that point, the importance of not only having a person there, but somebody you have a therapeutic connection to, how powerful that can be. And one of the things we're doing a little bit different at Cathexis is if another clinician refers somebody to us, or if a client we have has another therapist, we'll invite that therapist to come in and be in the sitting room with them. That'll be something that the two of them have to arrange independently of us. But they're welcome to come in and participate that, because there's something so important about having that shared experience together. For the integration piece. So that's great. There, now I said it and I can forget it.
No, and I, of course, is sharing after when EJ and I kind of share our experience. I want to piggyback on that, because that to me was the most important piece.
Well, let's go ahead, and I think it's a great opening to, kind of talk about, we were, sort of graced with the opportunity to do some training with you and go through this experience. And, are you okay with Tarah, like talking a little bit about it?
Oh, yeah.
Yeah. Well, first.
Because the idea too was like, couples and doing ketamine together, and what would that experience be like? And so it was very new to me, and I'm not one to like be in a, what's the word I want to use? Altered state of mind.
Out of control.
I don't like to be. So I was just like, oh, I'll do it for the sake of the couples work we do. Yes, I will. But I was super nervous going in. But then I went to see Tim and Susie's facility and, saw Tracy there, and we got to see the space, and we met with the psychiatric nurse practitioner who did a great eval and assessment. And we were just like good to go that day. And my heart rate was like 99 and yours was 45. I'll never forget. I'm like, EJ is so calm and I'm nervous.
We definitely had different experiences going, because you hadn't had much of an experience with psychedelics.
No.
I had when I was younger.
But I remember keep thinking, like, first of all, the space is so comforting, and the chairs / beds, whatever you want to call them, they're just really relaxing. And I remember like, I can't have any expectations, because I was like nervous going in. And so the practitioners kept saying like, what's your intention? And my intention was literally to have my heart open to whatever the heck happens. And even when I would get nervous, like when Heather came in and gave me my first injection, my heart was probably like 109 by then. And I just kept imagining my heart being open, like just curious. And it's only 40 minutes. That's what I kept thinking, like, it's going to be okay. And then I think having EJ next to me, we're going through it at the exact same time, that felt safe. And then Tim was sitting near EJ, who was about 4 feet from me, maybe.
Probably.
And then Tracy was sitting next to me. And guess what? I immediately knew, you have to hold my hand, Tracy.
Yeah.
So she held my hand throughout my experience, which actually was very grounding for me. And then it just happened, right? And I won't go into too much content, but I will go into like the process for me was, and I'm hoping I don't cry because it was very profound for me, right? And I know every experience is unique, but I was basically able to, in my first treatment, go back to me being a young kid. I was around 8, and I was able to feel terror, which doesn't sound fun, but I felt safe. And so maybe my whole life, I just could never feel terror because I'm really good at keeping busy to not probably feel that. But it was able to be expressed and I didn't even know it was there. And that was like the profound thing. Like when I woke up from it, I was like, I had no idea I was even holding on to that. Like I had no freaking clue.
Mm-hmm.
And it was true. Like when I woke up and I will say the one thing that still sticks out is when you wake up from it, I felt so freaking vulnerable. Like, here's my husband. Like, I'm crying throughout.
Did you ever put your picture of your eye shades on Instagram?
So my eye shades look like a sweaty bra. First of all, they were like red satin. My little eye mask was red satin. And from the half down was soaked with my tears. So I'm crying throughout. It was like a grief roller coaster. It's like I'd be going up the hill like, okay, that feels lighter. And then bam, going down the hill, experiencing that grief, terror, whatever it was. And I hear EJ to the side of me, like laughing and giggling. And I'm trying to caretake him in my ketamine session because I'm a caretaker.
Yeah.
And Tracy, I remember, was like, just everything's okay. Focus on you. And I couldn't even caretake. My frontal lobe is not there. I couldn't do it, but I wanted to. I was like, I'm crying. I'm messing up with his. But no. But I will say that vulnerability you feel after, like EJ and I just cried together. I felt so, I always feel connected to EJ, but that safety and that vulnerability, I don't think I could ever feel that vulnerable. Like it did take something like that shuts off certain things in my body to feel that profoundly open. And then, I went home and kind of slept, ate a big cheeseburger. And then the next day and the next day and the next day, I like just memories kept happening, like in a really good way. I felt lighter.
Wow.
I felt so grateful that I could experience things that I didn't even know I was holding on to, like that somatic piece. I
hadn't heard that from you.
I felt so grateful. And then I started to do the integration work with my own therapist. And then, I knew the moment I woke up from that, the clinician and I were like, you're going to need a second one. I'm like, I know. Jesus, I know. And so I did a second one a week later, and holy moly, I was thinking like, okay, well now I'll be in EJ's spot. Like I'll be in a
giggling.
rocket ship and I'll be like, woohoo. No, the second one took me back to 4 years old. Again, a lot of maybe suppressed, repressed, unprocessed, whatever's stuck, right? The body keeps the score. It came out and it was powerful and it was intense and it was terrifying and it was beautiful at the same time because again, that core piece was like, I didn't even freaking know. And EJ was there and I felt so safe with him. And it's like we just had this better understanding of each other and my anxiety. I mean, you guys know I've talked on my podcast before, like highly anxious person. It's like all the puzzle pieces started coming together and
it was so amazing. And I'm going to disclose
Please.
one little piece.
Absolutely.
Just
feel free.
It just shows how the brain works. Like having that gone there and figured that out, then you're like, I know why I don't like malted milk now.
Yeah.
And it made perfect sense when you, when you shared how that tied in.
The aversion to freaking malted milk.
I know, right? And who would think that would have ties to trauma,
Yeah.
And just amazing.
Yeah. It was incredible for me. I mean, really insightful, but to me also like, again, I didn't even know. So I realized like just how good I am and how good it so many people are at not feeling uncomfortable, because we don't want to. And it's like I took 40 years, maybe 43 years of grief and pain and trauma. And I was able to like experience a lot. I'm sure there's still more. I'm going to probably do a third. And I was able to process it in a very safe place and then have my partner, EJ, help me integrate it. And then my own therapist to help me integrate it. And it's been, I know every person is different, but it's been life-changing for me. I feel like it was trauma therapy, like 10 years of trauma therapy in 2 freaking sessions. It's almost like unbelievable to me that I had that experience.
Yeah, it was really transformational for you. And being from my side of it as an integration specialist, to be a part of witnessing what you were going through, and then to see how you and EJ were even connecting, especially in the second session, the second treatment. It was, again, transformational. And I think about for couples who maybe each are stuck in their own places that create, some maybe not the best habits towards one another, and the intimacy, that intimacy that occurred between the two of you, just being in that room and experiencing ketamine in your own ways. Yeah. But then when Tarah, like EJ, knew to give you more support, and to watch, like, as we were trying to connect your hands so you could hold hands together. And Tim and I made a note, okay, we need to move the beds closer together for couples, It was outstanding and amazing. And, we also grow as integration specialists because of what clients are going through and what they're experiencing. And to be a part of that piece that breaks open and real work can be done in a way that moves somebody forward drastically. That's why I do what I do.
See, I'm really quick. I want people to know this, right? Because even it's been a couple weeks now since I did my last treatment, but like I still feel this profound gratitude. And so thankful. And I'm not going to cry.
You can if you want.
But that's how powerful for me this experience was.
I think like that obstructor of our infrastructure like works on 2 layers with the couples, because it works on the layer of like you as an individual are receiving this treatment, and it's breaking down the ways in which you sort of like hold it together / avoid, but then it also, for Tarah and I, it demolished some of the infrastructure in our relationship that all couples create, that we keep our we talk about this a lot in the podcast, is we perceive our partner as a threat often. And because we're so vulnerable, because we love them, because we want to be loved by them, and we got all this crap going on all the time. And so we build this infrastructure in the relationship that keeps us safe at times, but then also keeps us very separate.
Exactly.
And so like in that moment with Tarah, it was like, well, it obliterated it all, because one, she was so vulnerable and open. My stuff like was just like blasted out of the way. And then there was this like really just like deep heart connection for like a half an hour.
Yeah.
That then, like you said, everything kind of comes back, life comes back to you, but it's just, we have this like
shift
thread, or something's keeping with us around. Like, I just find myself a little more soft, a little more empathetic.
One of the things, as I remember it, that you said, EJ, in that point was that you were grateful that, like, because you were, knee deep in the ketamine experience yourself, and you were able to kind of crawl out of that in a rather amazing way to be present and give that extra support to Tarah. And one of the things you said afterwards was, kind of how grateful you were that you were able to be there for her, and as a contrast to maybe other times when some of these conflicts that were really rooted in this unknown trauma
didn't
made
understand.
And you couldn't be there. And you're like, I'm really grateful I could be there for her, and I haven't been there at those times in the past. And that really stuck with me.
Yeah. And it wasn't an
I didn't even know that.
It wasn't like a contextual understanding. It wasn't like the information I was learning was creating a cognitive process that then allowed me to feel more connected to her. It was a complete emotional thing.
I think it's the vulnerability that was being expressed during the couples session in this, non-ordinary state of consciousness, right? Yeah. And I think about attachment styles. We can be avoidant, depending, anxious attachment. That all went away.
All my avoidance was out the window, and I got
it
plenty
went
of it.
away.
Can you have ketamine every day? No, I'm kidding.
And that piece, to be able to bear witness to that piece with the two of you, was also transformational for me. It helped me to really see that we can pull down that ego defense, become vulnerable when normally we may not be doing that in our relationships. And the growth factor that happened for the two of you in those two sessions.
And continues to happen every day after.
Far-reaching. Yep. Exactly.
Every day we talk about it. Every single day.
Oh, I love hearing that.
Yeah.
No,
I have to. It was that impactful for me.
Absolutely. Yeah, it's still rolling out. It's hard though sometimes. Like I've always felt this way about cathartic experiences, like that they're so amazing, like when they happen, and you're only touching it in a softer, more subtle way in the weeks after. But I found like that this is, again, it's like it's preserved in a way that my other experiences in this realm have not preserved. And that might be where I'm at right now, but it also, I think, is the environment, and that it's not something you're doing in like a weird, sort of multi, I don't know, like you are there to use this to figure your stuff out.
To release, to release.
Well, when that vulnerability comes out and you have an integration specialist there that you can also work with afterwards, that connection is even more profound.
Oh, yeah.
And the vulnerability that comes out of, for some people, the ketamine experience, it does break down that avoidance attachment, that we've been living in for so long, or, anxious attachment, whatever that is for each person. And we're with the person, the integration specialist who walked down the road with us. And there's such a bonding that comes from that, in working with mainly, I mostly work with people with severe trauma. So more than likely they've got a post-traumatic stress disorder or treatment-resistant depression. And it's really challenging to get to the place that we were able to get to with the two of you, and then to break through that and to start to make those pieces of change that actually are what we want to be working on, because again, that gatekeeper was gone, and to work with somebody who's been there with you is unbelievable.
And we're so focused on the gatekeepers. That's all we treat. That's all we treat a lot of times in our therapy sessions. Is all we treat are the things that are the positive and negative infrastructure that they've created to avoid the stuff that this experience allowed us to just like
jump into,
blast right to.
So EJ, can I just ask you, because I know that we focused on mine and like how incredible and uncomfortable and scary and beautiful it was. What was it like for you?
Well, it was kind of like a tale of two stories, right? Because it really is, like Tim said, it is a internal experience, and so when I was in the internal state, mostly in the first one, and then like about a quarter or so probably of the second one, it was where I go. It was up in my head. It was like wrestling with like all of these core beliefs that I have about the world that limit me, but in a really like expansive, the only thing I don't want to like, that I've thought about many times, like I think of like Gandalf in that scene where he's like fighting the demon and they're like going through space, like it was like an intergalactic battle against all of my negative thoughts. And then the minute I would find myself gripping, there would just be something I was allowed to let go, and I never let go. I never let go in my life. I'm always, but nobody knows it. I got this like calm exterior, but I'm inside my head like fighting continually.
That's such an interesting metaphor or image that you have, because in that storyline, that's when Gandalf the Grey becomes Gandalf the White. So it's really a scene of transformation
Wow.
and, kind of coming out of the cocoon and becoming the butterfly.
It feels like it. I mean, and it's exactly where I was walking into the work, but it gave me like an actual like experience of it instead of it just being fighting it inside my head, fighting the fight in there. It was like I was there and then I was able to let go. And so in that level, it was incredible internally. And then the second, where I was sort of more plugged into you, it was just incredibly connecting. I mean, it was just incredibly, it's just, it's emotional to think about. It was just like, I just felt such more deeply connected than I've ever felt with you, and just empathetic and loving of you and loving of your strength. And like, I was able to be there too, like in ways that like sometimes I get frustrated with myself that I'm not able to be there for you. Like I felt I was able to be there in exactly the way you needed to be there. And maybe the first time I've ever really felt that way.
Wow.
That's amazing.
And now it feels like triggers. Shit. We don't, what is that, man? We don't even, come on.
It's nice because we still got our
that.
stuff. We still get into arguments.
It's lighter though.
But there's something like this, just like, there's a click. An important click that we made. And so, I mean, first of all, thank you guys for facilitating that experience. Thank you for doing what you're doing, because this is like, there's a lot of suffering out there. If we can find better and better ways.
And the research is so incredible.
Well, I say thank you for trusting us, because that's where it starts. And both of you did. And you walked into it with really open minds as to whatever the experience would be. Something on a personal level. I'm hoping my oldest is now non-binary. But for them right now, that's the next step, is for us to look at ketamine because of the treatment-resistant depression.
Wow.
And they've been in therapy. They've been doing the work. I'd like to be mom and not a therapist. So I, really need to pull back and let them figure things out. But we can see clearly now that this is going to be the next step for them.
Wow.
And it's because they have also done their own research and recognize that they want to feel and live in today's world instead of behind the gatekeeper, the fears, all of that. Yeah. And so we're here for all of that. Yeah. I'm interested to know how it's been for the two of you coming back to work and working with couples.
Oh my gosh. To me, I feel like I've always felt like I can hold space and really attune, like that's just a gift I have. But I feel like there's this deeper connection to suffering and what might be there that I actually, because I've been through my own therapy. I've been through my own EMDR. I've been through psychodrama, didn't even know it was there. I know what the brain does. I mean, I'm a total brain nerd. I had no idea. I had an idea from the psychoeducation on trauma that I know, but I had no idea how it could just be stuck in there like that for so many years, even after I've done the work. And so I'm just I'm more curious, I'm more understanding, and I feel like I just go in with a little bit deeper of
appreciation.
Thank you. Yeah. And it's been significantly different how I am sitting in sessions now with clients, just because of my own experience. Not that me sitting in sessions before was a bad thing, people. Okay, just saying.
But it's expanded for you.
Because I've expanded, right? And I want to shout out ketamine for all. I can't do that but it's just with people who have profound success in EMDR treatment. I remember this one client was like, I just want to walk down the sidewalk and be like, everyone needs to do EMDR. And I feel that way about ketamine. If it feels safe and if you have, that environment where you feel like, yeah, I can handle whatever happens and I'm strong enough and I'm brave enough and I got this. I just sounded like Stuart Smiley on Saturday Night Live. Is that his name?
Yeah.
Darn it.
There's the mirror.
I'm smart enough. Okay. And what about for you, E?
It was an accelerant and an ongoing sort of confirmation that if I just can sit in that place of stillness, I can trust the direction that I just will go. you know?
Nice.
And that for me is really important in therapeutic work, is that I'm not up in my head. I'm not solving their problems, but I just have that, you know, I trust that when I open my mouth, when I hear what they're saying, that it's going to go in a direction of them moving away from suffering, letting go. I don't know. It's just like trust, I would say, is the big thing, is that like, man, I can't like intellectually muscle my way into trust in that this is a safe world.
That's right.
And that there is good, and that people that their resting state is wellness.
Yeah, it sounds like a stronger appreciation, to use that word again, that we all have that inner healer. Yeah. And that if we give it space, it'll go in the right direction. Yes.
And the inner voice, the inner knowledge that comes up, and if we can trust that and be vulnerable.
And help them get there, help them see that they have all the answers. I'm just a therapist. I'm just a guide. They have all the answers. They're there.
Yeah, it's there. Just how do we... I have to share just one thing that happened, because yes, it was intense and amazing and all those things. But I remember at one point, it was in the second treatment. It only lasted for a second. And I'm pretty sure the words that came out of my mouth were, duh. It was like, here I was. I felt like I was in a planetarium, and all of a sudden it was just like me with the world, and I was like one with it, not separate. And I literally felt that.
Yeah, there it is.
Duh. I think that's what I said. Like, it was just like I felt totally connected to the universe, to the world, whatever. You know, it was crazy. It was awesome.
Yeah, some of the scientific research that they've done, particularly with sheep, I believe, is when you get into the higher dissociative state doses of ketamine, it tends to block, I think it's the singular cortex, I believe, was the piece of the brain. But basically, it's the self-referential piece of the brain, which is where our concept of self happens, that gets stilled. So we start to lose, that's what they call the K-hole, where you go through what they call ego death, where you start to lose your sense of yourself as an individual. And so you have these, you'll see themes of space or of oceans are very common in a ketamine experience with that. And that's where you're getting into the deeper psychedelic experience part of it. And there's something about that, you know, when we're talking about altered state, that when you don't have that sense of self, it's almost like this Buddhist radical detachment to the nth degree. And it just changes your perspective on who you are, how you interact with the world.
Yeah. And it's almost like I couldn't get there until all these other things came out. Yeah. It's like a layered thing. It's like, okay, get rid of that, get rid of that. And then, okay, I'm ready.
Well, and with the two of you being parents also, what have you noticed in your own parenting styles?
I mean, I feel like my heart is just open. I'm loving. I'm taking every single second and just soaking it up. Just everything feels more present, I guess. And so I can be, you know, usually when I get home from work and I've held space all day for couples and individuals, and the twins are like, can we play family charades or whatever it is? I'm like, no. Now I'm like,
here's a charade for you, kid.
Charade is go to bed and pretend like you're sleeping, and then I'll come check on you in 8 hours. But now I just feel like I just want to come home and be with them. And we've been reading books together. And like, I just don't have that like exhaustion. Like, it's like something just broke through and it fractured for me. And I just feel way more whole, right? Instead of being in this narrative, like, no, I'm too overwhelmed. I can't do this. It's like, absolutely. I can still be tired. I can still be like spent from the day, but like I'm not in this story that would definitely limit me in many other areas. So so long answer to a question. I feel more present as a parent.
Yeah.
Great answer.
For me, it's like, if I'm not wrestling inside my head myself, then I stop wrestling everybody else.
Oh,
and
nicely
so
put.
I'm feeling like a lot less like I got to control this environment. I got to manage this conflict between these two people. I got to make sure this person makes the right decision for their schooling. You know, it's not that I'm detached and don't care. It's just like, you know, I'm not fighting it as much.
It's not your responsibility.
It's not, and it's not helpful. It's just like, it's grippy. You know, it's continuing to confront me with like, let go.
From codependence to healthy interdependence with ketamine.
Working on it.
I like it. It's like another podcast. Okay.
All right. Well, I mean, this has been stimulating. It's been personally moving.
Absolutely.
It's just fun. Like we love connecting with you guys because I feel like our hearts are in the same place, and our heads are in the same place too,
That's
which is kind of cool.
Well, I appreciate being here. This has been amazing. I had some nervousness that I shared beforehand. And EJ really did a great job in his next email to me about setting the stage for me, right? This is what the setting looks like. This is what will happen. Yeah. And it brought me a lot of relief. And I'm really glad that I'm here.
They gave us set and setting.
It did. It gave us set and setting. Thank you.
Yeah, we'll definitely. We'll talk more. So, Tim and Tracy from Cathexis Psychedelics. We'll definitely put up in our show notes, just some general information maybe you can share about ketamine, but also about your center and about what you guys are doing and how people can contact you as a business and as professionals. So thank you so much.
Yeah.
Thank you.
A pleasure.
Thank you. I know, like, I've said it before about, like, you guys literally are facilitating, like, transformational change for individuals, for couples, for families, right?
Yeah.
It's amazing.
Yeah. Thank you, Tarah, for going on that journey because it's been really positive for us, and you're obviously an incredibly brave person.
Thank you.
I agree.
Thank you.
All right. Well, thank you all for listening. We always appreciate your feedback, what you like, what you'd like to hear more about. Please feel free to reach out to us, via all of our social media.
And as always, just take care of yourselves, take care of each other. See you soon.
Bye-bye.
Bye.
Me and you just singing on the train. Me and you listening to the rain. Me and you, we are the same. Me and you have all the fame we need. Indeed, you and me are we.